Happy little feet is what we're going to be talking about for the next little while with Dr. Sheldon Nadal. The number is 872-CFTO so that you can address your questions to him about your little guy or little gal's feet. They grow so fast, kids' feet. I have to ask the first question, how fast do they grow?
Well, it depends on the child and depends on the age. They grow as fast as they grow. Because of that, you have to leave a little bit of room in the shoe to allow for a little bit of growth.
Now, some of us try to leave a little more room than we should be, I guess, because shoes are expensive. All footwear is expensive.
They are, and I don't blame you, but if they're too big, they won't support the foot properly. And a growing foot is very important to support because most of the bones haven't developed fully, and so they're basically cartilage, and the ligaments are very loose, so the foot needs support.
Now, how big is too big?
Well, generally, you should leave about 1/4 of an inch to 1/2 inch at the toe. So there's a little bit of room for growth and a little bit of room for the child to wiggle their toes.
Okay, and Dr. Sheldon Nadal certainly knows because he is a podiatrist here in Toronto. Karen's got a question for you, so we're going to put you to air now. Go ahead, Karen.
Hi. When my daughter was born, she...
Hello?
Hello?
Hi, go ahead, Karen. I don't know if you've got your television set down, but you might want to just listen to what you're hearing. Go ahead. Karen?
Yes.
You got your television set turned down?
Yes.
Okay. Go ahead.
Okay, when my daughter was born, she had a foot that was turned in and needed special shoes. Now that she doesn't need them anymore, can she wear regular shoes or should she wear the boots still?
If the foot is now straight, she doesn't need special shoes, but in-toeing is a very important problem.
In-toeing?
In-toeing, when the child walks...
What some of us call pigeon-toed?
Yeah, pigeon-toed.
Okay.
Because a lot of the children will outgrow the pigeon-toeing, but it will put a strain on the arch, and it can result in flat feet. So it's important for children that are in-toeing to be treated, in mild cases with an arch support or an orthotic. In severe cases, they can use special shoes or night splints, and I brought a night splint with me, which is down here.
Now, how do I know when it's a problem that should be looked at? I guess I should get myself to a podiatrist just
well,
in case.
I think children should be looked at least once a year. And that can prevent a lot of problems. This is a night splint, and it's actually a metal bar with 2 plates that can be adjusted to turn the shoe in or out as necessary.
And I attach the child's feet to this at night?
The shoes attached to the child's...
with my child's foot in the shoes, though.
Yeah, it's a night splint. The shoe attaches like that.
It seems so uncomfortable. I wouldn't want to sleep like this.
I don't blame you. We have newer ones that are hinged that are much more comfortable and will actually allow the child to crawl while the feet are held in proper position. So it's not as barbaric as it seems.
But if you look at the option of going through life in-toeing or being pigeon-toed, this is worth it for them.
Well, in most cases, children will outgrow the in-toeing unless it's severe. But as I mentioned, if you don't treat it properly, they can end up with flat feet, and that can cause problems like arch pain, heel pain, bunions, and hammer toes in later life.
When a child complains of pain, oftentimes we ignore them because they do sometimes whine and complain about things that aren't in fact happening. When do I know that I should be listening to what my child is saying about their feet or about their shoes?
Well, I don't believe in so-called growing pains as being normal. A lot of pains are written off, oh, he's just growing or she's growing pains. Generally, there's a reason that the child is getting leg pain or knee pain or foot pain, and if they complain about it regularly, they should definitely be examined. In many cases, if a child is flat-footed, he'll get leg pain or he can get knee pain, and that can be treated really easily by putting a support in the shoe called an orthotic, and I brought some of those today too.
Well, my goodness, you were efficient.
Yes. This is...
We think of those for adults and for athletes, but not for children.
Children have foot problems too, and if you catch them when they're young, you can avoid problems in later life. This one has a special clip on the outside for a severe flat foot. It helps to hold the heel straight and helps to align the foot better.
And the other one?
This one is angled, and this is for a child who is toeing in, and this supports the arch while he's growing, and it also encourages the child, because of the angulation here, to toe out a little bit better. So it helps to encourage the normal growth of the child from going in to more straight and out.
You podiatrists have got everything
covered. We try to think of everything.
Kitsa, good morning.
Good morning.
Go ahead. Hi, you're on the air, and we're just waiting for your question. Hello, Kitsa.
Hello.
Hi.
Yes.
We're ready for you.
Okay. My question is, I have a daughter. She's almost 5 years old.
Yes.
And apparently, by the time she born, she have a flat foot. And whatever I told him to the doctor, he told me she doesn't need any special shoes now. When she was a small baby, she was wear the first pair of shoes which you saw on the television. But now she doesn't need anymore.
And your question is, Kitsa?
What do I have to do for that?
Okay.
Okay, if the child has flat feet and there are no problems, the child doesn't necessarily need supports. But if there's a history of problems, or if the parents have flat feet and have developed problems such as bunions or arch pain or heel pain, then you should consider that, because a lot of problems are hereditary. I would recommend you see your local podiatrist and have him look at the foot, the child's foot, and see if there's any potential for problems later on.
Now, since we're in the winter, what's different about buying ski boots and winter boots for children than buying shoes? I'm going to let you think about that question. You know what we're going to do? We're going to take a commercial break. We're going to come back, get an answer to those questions, to other questions that you may have, and more. We're talking to Dr. Sheldon Nadal about children's feet, because he's a podiatrist and certainly knows all the answers. 872-CFTO is the number for you to dial so that you can pose your question. Now, going into commercial, I asked you about buying ski boots and skates and winter boots, because that's primarily what many of us are purchasing right now. And we tend to think, well, he wears a size 12. I'll buy a pair of size 12 boots off the table, take them home and stick his foot in them.
With ski boots, it's an expensive proposition. It should be done right. A good ski fitter, such as the people at Sporting Life, can help, and they lent me a ski boot. And here's the shell. And what they do, first they measure the child's foot in centimeters, and then they pull out the appropriate size boot. And then they put the child's foot into the empty boot, and they put the toes all the way to the front. And then they try to get, they put their fingers behind the heel. There should be about a 1.5 finger widths between the child's heel and the heel of the boot. They then they then pull out the liner, which goes into the boot, and when you measure the child's foot, there should be about 1/4 to 1/2 inch between the end of the toe and the front part of the liner. And that way there's room for the child to move their toes, and also a little bit for growth, because depending on how fast the child's growing, they could end up growing out of the boot during one ski season. You don't want that.
No.
The main thing where it should be snug is around the ankle and the lower leg for control.
The ankle and the lower leg. Now, skates, most children are wearing those sort of molded skates.
Okay, with boys' skates, usually they fit about 1 to 1.5 sizes smaller than a shoe. So if the child wears a 6, they might wear a size 5 skate. In hockey skate, in both types of skates, hockey and figure, the skate should grip the heel snugly. And there should, ideally, in an adult, there should be, the toes should just barely feather the edge of the boot. But in a child, you want to leave a little bit of room for growth.
Okay.
If they're too big, it won't hold the foot properly, and the child will have trouble skating.
So don't bother trying to get 2 seasons out of those skates.
Well, do the best you can, but try to keep them fit as closely as possible.
And just before we take Jane's call, winter boots, is it okay to just buy a pair of size 12s off the table? And
again, they should fit properly. If they're too big, they won't support the foot. There should be a little bit of room in the toes for growth, and allow the child's toes to wiggle. They shouldn't be too tight, because it'll cut off the circulation.
So I'm still looking for support, not just something to keep their feet warm and dry.
Yeah, basically, yes.
Okay. Hi, Jane. Thanks for hanging on.
That's okay. My daughter is 6 months old, and we've been told she has metatarsus adductus, where just the front part of her foot turns in. And we've been told she should wear a splint. It's just her left foot. Now, she's 6 months old, and we were told at 3 months this would have corrected itself in 6 weeks or so. Is she too old now, or will it still help, or would the leather boots do just as good a job?
The treatment will help. Sometimes they'll use a reverse last shoe, which points the toes out, because right now the toes are pointing in with metatarsus adductus. The other thing you can do with the young child is you can exercise the foot yourself by gripping the heel to hold it steady, and then pushing the big toe joint and the little toes in an outward direction and holding it there. So that'll help. In severe cases, they'll use serial casting, where they'll actually use a plaster of Paris cast to hold the foot in that position to help the child as she grows. But the best thing is to have the child examined, and it depends on the degree of severity what would be done.
Now we're talking about foot problems, so I might as well slip in my little problem here. I have a little guy who has warts on his toes, and I mean, dual film has been my life now for months trying to get rid of these, but I understand that's fairly common.
We see a lot of kids with warts. Warts, Noreen, are due to a viral infection of the skin, and it starts small and it can spread, as you know.
I wish I'd caught it much earlier, because this has been real rough.
I'm sure you're making headway. With children, we'll use a drying agent for the skin, because in many cases, we see children with really sweaty feet are the children who get warts. So if that's the case, we use foot powders to dry their skin, and then we use a topical acid medication, which is applied right on the warts, and it eventually causes them to blister off, and it takes the skin blisters and it takes the warts with it.
But if you catch it early as opposed to later, like I did,
the sooner the better, because they spread.
And with about 30 seconds to go, while people are making note of the Bayview Medical Center address where they will find yours truly and your phone number, what about the little kids that walk on their tippy toes? Should I be worried about that, or will it pass?
In mild cases, it's not a serious problem. It's a matter of stretching the calf muscles. In severe cases, with severe tiptoeing or with severe high arches, that's very important, because it can be indicative of a neurological problem such as cerebral palsy or spinal disorder, so they should definitely be examined.
Okay, good advice from Dr. Sheldon Nadal, a Toronto podiatrist, who says pay attention to your kids' feet. We're going to take a